When SNAP benefits disappeared overnight, Columbus faced losing $1 million per day in food assistance for 180,000 residents. Listen to hear how the city mobilized across departments in crisis, why a life expectancy story map sparked citywide action on chronic disease, and what happens when philosophy and policy meet population health. You're listening to the PHEC podcast, episode 436. Welcome to the Public Health Epidemiology Conversations podcast, where we have honest conversations with public health professionals who are creating meaningful impact in communities around the world. They know that the field of public health touches everything. I'm your host, Dr. Charlotte Hughes Huntley, and today we're exploring the fascinating journey of our guest and diving into another conversation that bridges different perspectives with the practical wisdom you need to fuel your impact. Greetings, everyone, and thank you for joining me on this episode. My name is Dr. Charlotte Huntley, and I lead an epidemiology consulting firm that supports large nonprofit organizations and community health foundations. We specialize in a variety of community assessments, workshops, and trainings, ultimately helping our clients communicate their health information in plain language to their community partners, as well as the broader communities that they serve. The support that we provide often falls in the category of strategic planning and sometimes capacity building. Please reach out to us through our website, drchuntley.com. We'd be happy to meet with you and explore how we might be able to support your organization. Links will be provided in the show notes. I'm very excited to introduce you to my guest on this episode. Columbus's Assistant Health Commissioner came to public health through an unconventional route. With a background in philosophy, politics, and economics, he brings a unique lens to population health challenges. Years later, he's leading innovative work in Ohio's city capital. The conversation explores how Columbus responds to sudden crises like SNAP benefit cuts, why the city chose storytelling over dashboards to address life expectancy gaps, and what happens when philosophy meets population health. Hear about building coalitions, making data accessible, and finding your way into public health work. Let me formally introduce my guest, and then I'll connect our conversation. Assistant Health Commissioner Edward Johnson helps lead the 2024 Best Health Department in the nation of nearly 600 public health professionals across 90-plus programs who are focused on neighborhood-based approaches that address the social determinants of health. He currently oversees the Environmental Health Division, where over 8,000 restaurants, markets, public pools and spas, body art facilities, campgrounds, and tobacco retailers are licensed and inspected. This includes the Addiction Services Division, implementing the Columbus and Franklin County Addiction Plan, currently presiding over multi-year decreases in overdose deaths since 2020. And lastly, the Center for Public Health Innovation, which is naming racism as a public health crisis and seeking to increase Columbus's life expectancy by reducing racial health disparities and raising quality of life. He has more than 11 years of combined experience in public policy and public health, having served in staff roles at the Ohio House of Representatives and Columbus City Council. Edward holds degrees in philosophy, politics, and economics from Xavier University and international economics from Valparaiso University. Let's connect my conversation with Assistant Health Commissioner Edward Johnson right after we highlight our sponsor for this episode. Public health is about connection, and now you have a space built just for that. The PHEC Podcast Community app is where public health professionals come together to collaborate, share ideas, and support one another. Inside, you'll find exclusive events like Power Hour, which is our virtual co-working event. It helps you connect with others and boost your productivity. You'll also have direct access to conversations with other public health professionals from around the world, and even guests from previous podcast episodes. We're more than a podcast. We're a thriving community. Be a part of it. Download the PHEC Podcast Community app today and join us. Well, welcome back to another episode of the Public Health Epidemiology Conversations podcast. I am joined today by a very special guest who is in Ohio. I'm joined by Edward Johnson. Edward, welcome to the podcast. How are you?
I'm very well. Thank you for having me, Dr. Huntley.
I'm excited for our conversation. We were chatting just before hitting record. I always like to ask about the weather. I'm here in South Carolina. I said, we're having a cold morning, and you let me know you're having your first snowfall. So I think
Yes, happy to delay it until November. Sometimes it comes in October, so we'll take that as a small blessing here in Ohio.
nice, nice. Well, I'm really looking forward to our conversation and getting to know more about you and some of the exciting work that you're doing there in Ohio. So let's start with you just telling everyone a little bit about who you are. Just introduce yourself.
Well, my name's Edward Johnson. I am an assistant health commissioner here at Columbus Public Health. Columbus, Ohio is the 14th largest city in America, which I know can surprise people from time to time. We are the second largest city in the Midwestern United States at just over 900,000 residents. And so I have the privilege of serving in public health those 900,000 people, but also the 49 million visitors and tourists that we get to our city every year for any number of events. I came to public health completely by accident, which I know is sometimes a highlight of some of your guests, and sometimes your guests are completely steeped and classically trained in public health. So I just love the dichotomy when I listen to your show. I studied something called philosophy, politics, and economics in undergraduate, which was a wonderful way to completely terrify my mother, who wondered, what in the world are you going to do with this, and will you be gainfully employed and housed moving forward? And thankfully I am. So that's a little bit about me, but I have a policy background, an economics background, and I think the philosophy really comes in handy as well, surprisingly, in the public health field as
Yeah, that's an interesting background. I chuckled thinking about your mom's perspective as the mother of some adult children. I can relate. That's really interesting. I love, and we're going to dive in definitely into a lot of what you're doing right now. I always love to kind of roll back and hear a little bit more of the journey, roll back time a little bit. And I know you kind of, you say you accidentally, kind of landed in public health, but tell us a little bit about your journey. Do you remember the point that you first learned about public health?
I do. And I won't say that it was the most positive interaction in the world. Having a political background, I had the privilege of working at the State House here in Columbus, Ohio. I was part of a fellowship program that gave us a lot of diverse experiences across subject matter portfolios and members across the entire Ohio House. And I remember going to a health committee hearing, and they talked about a number of bills, some of them interesting, some of them about, the practice of medicine or the practice of nursing. And there was a piece of legislation that was highly controversial about reproductive rights. And I realized that's why the entire room was packed. And that's why there was an overflow room. And that's why there were people loitering in the hallway, was for this one bill. And it was really acrimonious. And I realized people were not talking to one another. People were waiting for their turn to raise their voice at other folks. And I realized of the 25 policy portfolios in that chamber, I said, you know what, I can whittle this down to 24 that I might be interested in at the time. And that was really my first exposure was watching people be very upset with each other. Um, and so I avoided it for a time. And I went to Columbus City Council after that at City Hall, and did not have the privilege of working at the health committee, even at the city level, which provides legislative oversight for the health department. And then the health commissioner said, "Hey, I need a policy director." And I looked her in the eyes, my boss, Dr. Mashika Roberts, and I said, I don't actually know what you do. And she said, "Of course you do." And I said, "No, no, no, you don't understand. For a couple of years, I avoided the topic of health. And I just haven't had the privilege of working on this with the chair of the health committee. So I really, really, really don't know what you do. And she said, that's fine. I need a policy person. I need someone that understands how health can fit into the broader community and fit into policy conversations. I'll teach you public health along the way.
Wow, it's incredible, and it's like you don't really wanna hear the this kinda sad part that that's your introduction, but at the same time, that's something that we can we need to be aware of and conscious of, and that's unfortunate.
I think it's really important and very serendipitous, shall we say, that that was my introduction because it served me well when 2020 hit, shall we say, or 2021 hit. And I saw how conversations went with my introduction to the topic of health policy. And I think it informed how maybe we were able to turn the volume down ever so slightly here in Columbus, Ohio, around how we talked about COVID-19 policies and regulations.
Yeah, I understand that point. So how long since you've taken this role to now? How many years?
I've been in public health for 6 years, or excuse me, 7 years now. My apologies. And for three of them, I've been an assistant health commissioner. And the previous four, I was the public policy director. So I say I was effectively the health department's lobbyist.
Fascinating, because I bet you have picked up so much along the way and definitely covering that time in, like, the height of the pandemic and then rolling into, what we're dealing with in our country today with so many shifts from this political administration. You've gotten graduate level education on the go in real time.
I think so. So, Dr. Huntley, if you're handing out honorary MPHs, I would like to be at the front of the line, please.
Absolutely. Let's talk a little bit about I know you have a project that you're especially proud of, and as an epidemiologist, I'm excited to hear more about. I know you've been one of the many responsibilities you've had has included, data modernization. So can you talk a little bit about that? I'd love to hear more.
Absolutely. Columbus Public Health is very fortunate to be a recipient of the Public Health Infrastructure Grant, the FIG grant from the federal government. And so we've used a lot of that to fuel and fund our data modernization efforts. And so working with a fantastic team that is now known as the Data Modernization and Epidemiology Office, which I believe is a team that's about 15 plus strong, we've started working on storytelling, something that we really felt was a deficiency coming out of the pandemic, and not at anyone's fault or blame. We were moving at a million miles per hour to do the best we could for our neighbors, for our sisters and our brothers. But we also saw that there was this deficiency in terms of data can be a very cold comfort. Numbers don't lie, but people remember stories. People remember how they feel about things. And so, using the power of narrative, using the philosophy of storytelling, which can give meaning to the numbers, can give meaning to the data, we've worked on creating a life expectancy in Columbus story map. And we wanted to be really clear with our community and with anyone who sees it. It's not a dashboard. It's not a data dashboard, it is a story map. It is designed to help explain the temperature of life expectancy and health in the city of Columbus. And we endeavor to tell that story in three different ways in this story map. So, whatever appeals to the individual seeing it, they can apply that to their lives or to how it motivates their work. And so, we tell that story across time from 2014 to 2024 to see how things have changed. We tell that story across 20 different neighborhoods to say that place matters. What's around you matters. And then we also tell that in terms of racial health equity, saying that there is a difference between white Columbus residents and Black Columbus residents. And we want to be able to say that difference can and should be addressed. And so that's what we spent a lot of time explaining to our community, explaining to our sister agencies throughout city government, explaining to the social services sector who have seen this, and it confirms and it affirms their reality of what they're experiencing in their community and the people that they're serving. But it also ties their work, which may or may not be explicitly tied to health and public health. It ties it to health, and they can see themselves within this story map as well.
That's amazing. And is it publicly available?
Yes, this dashboard belongs to the people of Columbus. And so this is publicly published. We say we are happy to give a presentation. We are happy to walk you through it if you want to. But the story should also be able to tell itself. You should be able to read this story map on your own without a public health official standing over your shoulder telling you exactly what it means.
That is a huge win for communicating public health, communicating epidemiology, which we have not really done very well in this plain language, easy to understand way. What's some of the feedback, like responses that you're receiving from users, your community members?
I think one of the first things that we hear is it's it's really revelatory and it's a lot. And it's exactly what they need, and they can take some parts that really apply and help them, and there are some parts that they say, "Thank you for providing this, we just don't need it." And we say, "That's okay." One of the first things that we say is when we tell the story of Columbus's life expectancy over time, over that decade, 2014 to 2024, you don't see a lot of change. It seems like we're holding steady, but there's still a story to tell there. And we tell the story that, yeah, Columbus experienced the same dip in life expectancy that the entire nation did post 2020. We've gotten all those years back, though, and we're very proud of that. But we also say Columbus exists in a broader context than just the 250 square miles that make up our city. We exist in the state of Ohio. And over those 10 years, the state of Ohio's life expectancy has gone down. So we're doing something in Columbus that's stemming the tide, but we could be putting ourselves in a better position. That's something that people really resonate with. Something else people resonate with is when we tell the story across neighborhoods. Our longest lived neighborhood and our shortest lived neighborhood are separated by 20 years and 11 miles. And so we have to figure out what's going on there. And we're able to look in on those causes of death, mortality, and we say, what's happening on the hilltop that's not happening in Hayden Run. Hayden Run being our longest lived neighborhood, excuse me, and the Hilltop being our shortest lived neighborhood. And then when we look at it racially, it tells an even different story because we're able to say there is a 4+ year gap between our white residents and our black residents. But we don't just say there's a gap. We actually say these are the causes that go into the gap. There's a 4-year gap. We know that 2 of those years are chronic conditions. We know that 1 of those years is just homicides. Half of a year is unintentional overdoses, and then we get into all the other causes after that. And we say, if we want to address that gap, here's what makes that gap happen.
I'm excited about something like that. That's a valuable tool. That's an incredible way to, I want to say, empower the community. But the community should have this information. We should be able to see the landscape of our city compared to maybe how it looks across the state. Do you think that other cities in Ohio are looking to adopt something similar?
I hope so. Our sisters and brothers in Cleveland are also part of something called the Big Cities Health Coalition. We've been able to share this with them. I have a soft spot for the city of Cincinnati and Hamilton County, where I went to college and university. And so this is something that we share with them. And we also share our experiences. Our director of recreation and parks saw this presentation and contacted my boss, the health commissioner, and said, "Can you present this to our leadership team?" And I said, of course I can. That's not a problem. Unbeknownst to me that they had incorporated this life expectancy story map into their 10-year strategic plan. They said if chronic diseases are some of the leading causes of death overall, chronic diseases are the cause of this life expectancy gap. We as a Department of Recreation and Parks have an obligation to address this alongside public health. So they said, we know public health regulates the smoking age, and we've banned flavored tobacco products here in Columbus. And that's the health department's contribution in a big way to chronic diseases. But if we're recreation and parks and we maintain so much programming that is about having our community be active, outdoors, walking, running, working out, whatever the case may be, they said that's part of our 10-year strategic plan. We have to own part of chronic conditions as well. It's not just play for play's sake.
Yeah, yeah, I love that. Well, that's really great to hear. I know that I would love to see it across state, multiple states incorporating something like this. And I know that other areas are doing making some real advancements in the area of data modernization. But every time I hear of a story or a case where there's the connection to or really tapping deeply into communication and accessibility for the community's sake, I am really, really encouraged by that.
Absolutely. Dr. Huntley, as you say that, I'm reminiscing about a very arduous policy fight that we had, which was banning flavored tobacco. I think Columbus might be the only city that's not on a coast that has a comprehensive flavored tobacco ban of all products and all flavors. This was not easy, but one of the most compelling pieces of information that we could give was that heart disease and cancer were two of the leading causes of death in Columbus, Ohio. And if you don't have a health department that's addressing the top two leading causes of death, what do you want us for then? And that's where our city council said, you're right. This is big. This may be controversial, but we're going to do it. We also were able to say, at the time, Columbus's smoking rate was 36%. 1 in 3 Columbus residents at the time smoked. Our most recent data says that smoking rate is down to 13%. And that's in 3 short years.
Oh, that's really good to hear those kind of wins and advances. That's incredible. I love that. And I keep saying it, like we have some real problems and some real big challenges. And I think when we hear these wins on the local level with tools like the storytelling, the power of storytelling, I think that we're getting the buy-in of the community when they're able to understand the data, the story that goes with the data, and see themselves in it, understand how certain indicators are impacting health, then they're going to you get that community buy-in. They're it's a collective effort to legislate or policymakers, and it's not just a few passionate public health, professionals going, but it's that community buy-in, and collectively we're going to our local policymakers, lawmakers, and saying, "We don't need this," or "We want more of that, and here's the data, and we understand it." And that's what we need more of, on that local level. So I love hearing that.
Absolutely. And I think as public health professionals and in working with our data modernization team and our epidemiologists, one of the things that I can bring with my background in philosophy and politics and economics is to say, when folks go to their local city council meeting or when they go to a state house committee hearing and they offer testimony, one of the things that we have a responsibility to do with the data that we hold on behalf of our community and our ability to communicate it is to ensure that the plural of data, the plural of stories is not data. Because there are a lot of people who are going to tell a lot of stories. And if we let them continue to tell those stories in a vacuum without saying, I hear what they're saying, and yes, I can explain that with the data. If you see here, what these folks are experiencing is represented here, we've really ceded ground inappropriately. And so I think that's what good storytelling does is it acknowledges that people are having diverse experiences and it can account for that, but it also says, here's the other stories that you need to know as well.
I love that. I know that as much as I love the wins, and this is still kind of we need to kind of feed off of this. And I'm still, as at the time that we're recording this, I'm still in the energy coming back from the American Public Health Association's annual meeting where I participated in the first rally for public health on the national mall. So I've got a lot of good energy kind of that I'm still fueling off of. This next kind of question, I'd like to know more about some of the challenges or how you're addressing some of the challenges. I know that you and I were talking a little bit before the actual, we hit record about SNAP benefits. And I, have a friend who is a colleague and she's actually been on this podcast, Rachel Cahill. I'll have to make sure I link to her episode in our show notes, but she's in your state. She's out of Cleveland, if I don't get that wrong. But, we've talked a lot about, SNAP has been leading the news and, that's been top of mind for everyone. Do you mind talking a little bit about some of the challenges that you face with that and how you guys have been addressing it?
Absolutely. So here in the city of Columbus, we sit in a county known as Franklin, so Franklin County. With the government shutdown, we've had just about 180,000 of our sisters and brothers impacted by no SNAP benefits coming in. Franklin County receives about $31 million a month in SNAP benefits. So, for the sake of conversation, and I know I'm talking to an epidemiologist, so I can see your heart breaking as I'm getting this out. We're going to call that about $1 million a day. Columbus and Franklin County is losing $1 million a day in SNAP benefits. And so that was a way to convey this information to our community that we are going to try our best to help. We're going to step up because that's what we do in Columbus, but we're not going to be able to replace $1 million a day in food assistance. We are on the precipice of what I was going to say from a storytelling and a meaning making perspective, a man made famine of $1 million a day. And so the city of Columbus and Franklin County stepped up. We were able to find some emergency funding over 2 weeks, totaling about $750,000. So three-quarters of $1 million over 2 weeks. But we're losing $1 million a day over 2 weeks. That's $14 million. And so I kept a nickel in my pocket as we were trying to figure out where do we go? What do we distribute? What's the best tactical way? And I said, guys, don't forget, for every dollar somebody's losing, we're only filling in a nickel over the next 2 weeks. We were able to set up 4 pods. And for those in public health emergency preparedness, please don't throw anything at your phone or wherever you're listening to this wonderful podcast. But we use the pod model, which is normally for pills, antibiotics, vaccines. The mayor's office came to us and said, you're so good at standing up kind of these emergency points of distribution. We know food isn't your bailiwick, but we know you have a heart for service and we know you're really good at this. So we used our public health emergency preparedness principles. We set up an incident command structure that included multiple departments throughout the city, not just public health, but brought in our public utilities, Columbus Department of Recreation and Parks, public safety as well, to say we need to get this food out to the families that need it the most. And so a lot of folks from Columbus were not able to attend APHA because the call to service came from our mayor's office that we had to lead our community's response to SNAP benefits being turned off and government shutdowns. So it's been a very trying 2 weeks here in Columbus for our public health professionals, but they've stepped up, they've answered the call. We've served, I think, just short of 10,000 individuals as of today. We have a food pod later today. We have a food pod on Wednesday. And then we're going to reassess and hopefully, some way, somehow, SNAP benefits have turned back on. But if not, we're going to step back up and set up more pods.
Ooh, I love to hear how all hands on deck and people are showing up and stepping up again in the local communities. Even in my local area, I'm seeing tremendous response, and then it's something we feel that we can make we can do something about. Actually, my husband and I participated in a local food drive just this past weekend, and it is something that we see the collective effort. And I like that like the nickel, you said you help, keeping that reminder. I think it's whatever it is that helps us to humanize the experience or put things in perspective. Whatever we can do, we should do to help us really stay present, I guess, is the best way of saying it. Stay present and relatable to the situation. I appreciate the way it looks like the infrastructure, even with like within your city and how the different departments are really cohesively coming together. That's a great model for others that maybe their areas aren't as, cohesive and conjoined, but it's possible, right?
Absolutely. For any public health professionals or folks in local governmental public health listening, I won't pretend like it was easy. So if you have questions, please reach out. This is the first time we've entered into an incident command structure as the city of Columbus, where multiple departments were represented throughout the command and general staff. So I don't want to make everyone think, well, Columbus has a history of doing this. This is just how they do things. This is our first time, and we're learning things as we go. But I can't say enough about our sisters and brothers throughout city government stepping up and answering that call as well. I'm almost kicking myself saying, we should have included them in previous ICSs. They would have been really helpful. We should have learned this lesson a few years ago.
Well, you're doing it now. That's important because this times that we're in right now calls for different action and we have to do things differently. And so stepping up now, and I think that's a part of the lesson. You can take the lesson from that, but you're not going to kick yourself. Just the fact that it's a great return from stepping up and trying something different. And when you try something different, if it doesn't work, then you decide, okay, well, now we know that didn't work. We'll try something different the next time. But it calls for, we have to take different action these days.
Absolutely. And I think this will be part of telling the story of social determinants of health. And I don't hear folks use that term as much as I did maybe half a decade ago. And I hope it's not falling out of vogue. But when you think about what those social determinants of health are, we've always tried to acknowledge as public health, we can't influence these factors on our own. So why do we keep trying to influence these factors on our own? Why aren't we working in this interdisciplinary fashion? And sometimes it's about building relationship. Actually, I take that back. All the time it's about building relationship and working with our division of police. Public health now has a role in responding to violence in our community, and it's interdisciplinary. And it's our division of police, it's our division of fire, it's public health, it's recreation and parks, it's our Office of Violence Prevention. And we're doing that in an interdisciplinary manner that we knew we wanted to be a part of before, but didn't know how to until we started getting in the sandbox and saying, I may not get everything I want out of this interaction this time, but I need to be in the sandbox playing with others and playing well in order for us to continue to work on these big important issues down the line too.
I agree with you. I'm enjoying this conversation so much. I know for the sake of time, we need to kind of wrap up, but I do have one more question I'd like to ask you because we've talked quite a bit about storytelling and communication, and I've really been leaning into how we communicate public health. On this podcast, we have a series, What is Public Health? Encouraging people to share their stories and share their plain language definition and explanation of what public health means, not the textbook jargon, but just how we communicating that. So I thought this would be especially, I'd love to hear from you, especially someone who kind of found themselves accidentally in public health and all that you have been challenged with over the last, 6 or so years. I'm just curious, how do you explain public health? And you are in such a unique position, it seems all the time. But I'd love to hear from you on, how are you explaining public health when people are asking?
Pretty simply, I say, how long do you live and how well do you live those years? There are choices in public health that can lead you to be healthier, wealthier, and wiser. But that means there's a converse to that statement too. There are choices in public health and in public policy and in society that unfortunately can make you sicker, poorer, and dumber too. And we don't want to head that direction. Not here in Columbus, not here in Ohio, and I don't think nationally we want to head in that direction either. And so I always say it's public health's responsibility to look at all the things that go into a long life and a healthy life.
I like that. I think that that's a great response that I can imagine would foster a great conversation. That's a great conversation starter too, because then the follow up is going to be, on any number of things depending on who you're talking to. Do you think that your family, friends understand what you do now?
I think they do. I think when I first got here, they said, "Not really sure. Are you doing restaurant inspections?" And I was like, "Well, no, I don't have that. I don't have that certification." It's like, "Well, we know you're not a doctor, so hopefully you're not seeing patients." And I said, "I promise I'm not. Please don't call the medical board." But I think they understand now. It's about moving the population level. It's about making all of us healthier, not just one of us or some of us.
Yeah. I really appreciate your response to that, and I appreciate your time sharing with us all the work, all these examples of the work that you're doing. I know there's tons more that we could probably spend all day talking about, but thank you for being here and for the work that you're doing.
Thank you for having me, Dr. Huntley. This was wonderful.
I really hope you enjoyed the conversation as much as we did. This conversation highlights how diverse backgrounds strengthen public health leadership. Columbus's work demonstrates what's possible when we make data accessible, build authentic relationships across sectors, and remain grounded in the communities we serve. Whether responding to immediate crises like food insecurity or addressing long-term challenges like chronic disease, the principles remain constant. Tell compelling stories, work collaboratively, and never lose sight of the people behind the numbers. Your path into public health matters, and so does the unique lens you bring to this work. I encourage you to connect with Assistant Health Commissioner Edward Johnson and learn more about the great work that he's doing in the city of Columbus, Ohio. You can find links to connect with him on the show notes page for this episode, which is episode 436. So this can be found by going to phecpodcast.com. Once you're there, just navigate to episode 436 to find the show notes. One more thing before we go. Remember that our podcast has an app and private community where you can engage with public health professionals around the world. You can download the PHEC Podcast Community app in your mobile app store, and it is available for both Apple and Android users. You can also visit phecpodcastcommunity.com to join the community on desktop. All right, everyone. Until next time, have a fantastic rest of your day. Thank you for listening. The show notes page is where you'll find links to everything we discussed in this episode. To find the show notes for all of our podcast episodes, just visit phecpodcast.com.